Why are you only now calling for more vaccines? A short time ago, I spoke to the Cumberland Mayor. He says it's simply too little too late. Why 4 weeks later are you calling for a rethink of the strategy?
Well, Danica, firstly, we've been calling on the vaccine for months and months and months. The Premier's been doing that consistently. We've been quite critical of the vaccine rollout. We've been critical how the federal government's stop-go approach on AstraZeneca in one way demonised it and made it a vaccine option that people were very reluctant to consider, where we have the opposite view here in New South Wales, where AstraZeneca is an appropriate vaccine that's been used globally. And we've been asking for that. But we've also been asking for Pfizer and more supplies, and we've been promised more supplies. And nowhere across the globe have we seen the vaccine rollout be so slow, and it's not in our control. So this is not out of step with what we've been saying for a very, very long time. And now what has occurred with the 3 shires and possibly 2 other shires that are becoming serious hotspots, the reality now is it's getting to a point where we need a focus by the federal government to get more vaccines to New South Wales and getting at least the first dose and the first jab done to protect people.
OK, but your strategy right now solely is dependent on people getting vaccinated. If National Cabinet doesn't agree to expedite vaccines into New South Wales, what does that mean for the state?
Well, Danica, firstly, the strategy for this nation has always been about vaccination. What we did well in 2020 and leading into this year was to contain the pandemic and the crisis. In one way, we're a victim of our own success because for months and months and months, we had 0 cases in the community. And in one way, that probably meant that people were a little bit reluctant to rush out and get vaccinated.
OK, but the state's currently 4 weeks into a lockdown, and right now the Premier's saying this could end up continuing until October with harsh restrictions. So right now the strategy is get vaccines into arms. If we don't get enough vaccines, what does that mean for the state?
Well, again, our health strategy has always been vaccines so that we can get to a level of normal. And the Crisis Committee will still make other decisions in relation to restrictions, how we manage the Delta strain, which is very, very different, and how we approach going forward. Those decisions haven't been made, and the Premier is warning the public that this is getting very, very serious. And it is serious. And we still have a number of options in front of us that we will have to discuss at Crisis Cabinet. But part of it is making sure we get more vaccinations. So my call out to everybody here today is get vaccinated, both Pfizer or AstraZeneca. It doesn't matter. Get GP advice on AstraZeneca if you're outside of those age groups and get the jab. That's the only avenue for the nation to get to a level of normal that is going to be permanent.
All right, this roadmap that the Premier cited today, what does it look like? Can you give people some sort of an indication of what the plan is out of this crisis?
Well, again, I've been charged with the roadmap and we've been working on it for a while. And the roadmap kicks in a number of stages in relation to what does July 31 looks like and what the months following look like. But that roadmap has only been a draft form. Crisis Cabinet will still have to consider it. And I'm not in a position today to be talking about the roadmap, but I can assure people it has a whole heap of options for the government to consider about how we get out of lockdown and into a restricted environment and into probably a more less restrictive environment. And all of it is what we will consider going forward.
Will we see some sort of an easing of restrictions next Friday?
I can't give you any answer on that. As I said, we put in some really tough restrictions last Saturday with retail and construction. And in some quarters, we've been criticised that we included construction, but it was all about mobility. And what we have now seen is large numbers getting tested. Those large numbers getting tested means we're getting more eyesight or more line of sight in relation to how many community transmissions there are or how many people in the community have infection, and today 53. So it's clear that those restrictions have only just come into play. We've got to give it the course of the 2 weeks, but the reality is by early next week, we'll understand clearly if those extra restrictions we put in place around retail and construction are helping us bring down the numbers. It's still too early to call. And until we see that data, we can't make any decisions about what next Friday looks like.
Well, what about schools? Can you give some sort of an indication to parents when their children might go back to face-to-face learning, and what does this mean for the HSC exams?
Again, I can promise you, Danica, that in the roadmap, it does talk about schools as a priority. We know that is a priority for our kids' education. It's a priority from an economy perspective. It's a priority in relation to the well-being of families and young students. And it's the number one priority in my roadmap. And look, as I said, the roadmap has to still go through crisis committee to get thrashed out. And I'm sure the Premier, in due course, will be able to share that with the public and give confidence to parents that we have schools, especially Year 12 students, in our line of sight in making sure we can return back to face-to-face at some point.
The Premier has been talking for the last 2 weeks that we're seeing green shoots. Today we had a concession that the lockdown simply hasn't worked. You've said in the past that we've probably lost control of this. Has the Premier been misleading the public in the sort of rhetoric that she's been using at her day-by-day press conferences?
Not at all. Danica, what we've seen over the last 3.5 weeks, and I've been a member of the Standing Committee, the Crisis Committee, for the full 18 months since COVID came to our shores. And what we rely on is the advice from health, the expert advice, and of course with the Delta strain, it's been more challenging. And we've approached it very, very differently.
But what are the green shoots? What are the green shoots?
Well, the green shoots is that actually people are getting tested. Isn't that a green shoot? 88,000 people today. If you rewind 4 days ago, that was 45,000. That means people are taking it serious. And if we get that level of data, we actually know exactly what's happening. So we now know today there was another 53 infected persons in the community. That means tomorrow and the next day we'll know what we're facing. And therefore we may be able to make some new decisions based on that data that gets us ahead of the curve. And that's why it's important for people to get tested. So that is a green shoot that people are getting tested. The other green shoot is the restrictions, even though people are judging us that they haven't succeeded in relation to going backwards, they are not escalating. We haven't got hundreds and hundreds every day. And the way this started, this pandemic, and it went from a few in Bondi, then half a dozen, then a dozen, and it became 50 and 60 and 100. And now we've sort of stabilised at 100. That is, or 100, 120 being the average. Then that is actually a green shoot in itself, that it's not accelerating to the numbers we saw in Victoria last year. They got the 600, 700, 800 a day. So there are some green shoots. Is it enough? No, it's not. And we've got to stop mobility, and we will continue to be challenged by that, and we'll continue to look to health advice, but also drawing on our own experience of what we've enjoyed over the last 18 months.
All right, just finally, there's more than 350,000 people across Greater Sydney currently living by themselves. When will the state government make an announcement around singles bubbles?
Yeah, that is an issue that has been raised, and as this progresses, if it was a 2-week or a 3-week lockdown, people can manage that. But as this progresses, the lockdown could continue. It is an issue that has been raised at Crisis Committee. I can say that those conversations are being had as we speak. We're trying to work through what that looks like. I think that, again, there'll be more to be said next week.
OK, so can you give us an indication when? There's a lot of people who are by themselves. They really need the company right now. Can you tell us, can you give us an indication?
As I said, we'll be back at Crisis Committee on Monday. All these items are up for discussion. I'm sure that the Premier will update the public after that.
Deputy Premier John Barilaro, thank you for joining me.
Thank you.